Yeah, guys, we'll be talking about abdominal distension, and we'll be talking about abdominal distension in relation to gastrointestinal diseases. Okay, so abdominal distension as a sign of gastrointestinal disease. Of course, abdominal distension is a sign, okay, because a few patients will come to you telling you that they have abdominal distension. In fact, patients don't really even know what is abdominal distension. Okay, but you on examination, you get to see that okay, this patient has abdominal distension. All right, so abdominal distension as a sign of gastrointestinal disease. You could see this is abdominal distension. You could see that the stomach is distended. Okay, it's abnormally bigger than before. All right, and there are so many things you need to watch out for abdominal distension. Okay, there's the abdominal distension that is natural. So somebody that is pregnant will definitely have a distended abdomen. Okay, and there are some abdominal distension that are pathologic. Okay, maybe there's abscess, there's ascites. Okay, that's like fluid in the stomach and all that. Okay, so a distended abdomen is abnormally swollen outward. Okay, so you can see and measure the difference. Okay, and sometimes you can even feel it. Okay, if it is ascites, there's a way you percuss it, and if there's a foul sound, you know that okay, this is a distended abdomen because of a medical condition. Okay, so a swollen abdomen occurs when your stomach area is larger than the normal. Okay, so some patients, their abdomen is larger but they don't really notice. Is when you get to like ask them like, hey, is this how your stomach was like before? Okay, that's when they even get to notice it. Okay, so sometimes it is known as a distended abdomen. That's a swollen abdomen is known as a distended abdomen or a swollen belly. Okay, so you could say normal when there's bloating in the abdomen, there's a distension. Bloating, that means like there's air. Okay, the distension, that means like the outside of your stomach is basically like responding to this bloating. Okay, it's like basically falling or becoming so flaccid. Okay, so when there's bloating and distension, there's basically fluid or air in your stomach, and it's actually pushing the stomach outward. The kind of question you ask for abdominal distension, you ask the patient, when did this start? Okay, when did you start observing that your stomach started becoming so big? All right, then is it progressive? Did it start like this, or it actually started smaller and it got to this stage? Then you check the eye for jaundice. Check yellow coloration of the eye. You check if there's jaundice. That means there's abdominal distension with jaundice. Then you check for pedal swelling. If there's abdominal distension, are the legs too swollen up? Okay, that's pedal swelling. Then for abdominal distension, there are some 6 F's that you need to actually look out for. Okay, the swollen abdomen, could it be fat? Could it be flatus? That means like air. Okay. Could it be feces? Could it be that this person has not uh, defecated for a very long time, so the feces are so much in the abdomen that it causes the abdomen to distend? Could it be fetus? Is the patient pregnant? Okay, if it is a pregnant woman, you know that definitely if there's a baby in her, the stomach will be distended. All right. Fluid. Is there accumulation of fluid in the stomach that is causing it to distend? Okay, that's ascites. Then functional, bloating often associated with irritable bowel syndrome. So this is basically you trying to look at the functional aspect of this. Are there other symptoms that are related to this distension of the abdomen? Okay, so guys, that's basically how to checkmate abdominal distension as a sign of gastrointestinal disease. When you examine your patient and you find out that they have a distended abdomen, these are the kind of things you are supposed to ask for. Okay, so guys, that's it. I will be up to the next sign of gastrointestinal disease. Bye for now.